You must demonstrate you can assess, plan, implement, and evaluate patients correctly. Assessment, planning, implementation, evaluation stations are a crucial part of the NMC OSCE, and many candidates tend to struggle here. But with right strategies, you can ace these stations at ease. In this video, I will break down each APIE station, what the examiner expects, and how you can avoid common errors to score high. Without further ado, let's get started. First point is understanding the structure of APIE. The APIE process is a structured way to deliver patient care. You must demonstrate you can assess, plan, implement, and evaluate patients correctly. Let's break down APIE stations. For assessments, what is required of you to do in assessment is to carry out a full set of observation following A-to-E approach and carry out holistic care on these patients. Simple. Next to it is planning. Having done assessment on these patients, the next thing you have to do is to identify two major problems, two immediate and pressing problems for these patients, and you need to write it in a smart way. The next one is implementation. Basic thing you are going to do here is to administer medication for this same patient that you started the assessment with. The same patient is the one you wrote two nursing problem, two pressing problem for this patient, and it is now time to administer medication in implementation station. Finally, on APIE, we have evaluation. Evaluation is where you hand over this same patient, all right, maybe to be discharged later or for further assessment, management, and package of care for this patient. Here are what you need to do to succeed in your assessment station. Number one, you need to follow the structured assessment framework, such as the use of ABCDE, that's A to E approach. Second thing to do is you need to carry the patient along, involve them, communicate clearly with the patient, ask them relevant questions, and carry them along in every step of their care. This is key. Examiners knows that respiratory rate is not always 16. You cannot falsify figures. It can be implicating. Document whatever you get and follow the time bound, especially for respiration and heart rate. It is important that you check each of these parameters for 1 minute each. I repeat, 60 seconds each. So before you record the vital signs, double check again to be sure of what you are recording to avoid errors. The fourth thing you need to do is you need to document correctly using clear, concise language in your notes. Here are common mistakes to avoid. Number one, skipping key assessment questions. Number two, rushing through observations. Number three, poor documentation. So the next one is planning. What about it? Like I said earlier, you have to identify two most pressing, that is most important problem that you need to solve for this patient. The key take-home here is do not assume on patient's behalf that, okay, because patient is having congestive cardiac failure, that the patient must be having reduced mobility. Please, if your scenario does not state it, or it was stated during assessment and during your planning, the scenario does not state the patient is having reduced mobility, do not use your own judgment to write care plan. It must be stated. Another key thing is, if it was stated during assessment, It doesn't mean that you must automatically carry it over to planning station. It might have been addressed. This is so common to pre and post-op patients. So you need to read your planning scenario, because scenario will be given to you. If it is not stated that the problem that was earlier identified has been addressed, then you can plan on it. Take for instance now a patient that is breathless during assessment may have stable breathing now in your planning scenario. So if you go ahead and write that the patient is still having difficulty breathing, whereas it has been addressed, it's going to be a fail. So you need to still pay keen attention to your scenario, to your planning scenario, not solely relying on assessment. But any problem that was identified in assessment, if it has not been addressed in your planning station, then you can write your care plan on it. I hope this is simplified enough. All right. Here are what you need to do in this planning station. Number one, you need to set SMART goal. What do I mean? Your goal must be specific, measurable, achievable, reliable, and time-bound. This is SMART as an acronym for that. If any of these key elements is missing in your planning, meaning you can be marked wrong. That is, the standard has already been set, put in place to guide you. Here are common mistakes to avoid in this station. Writing generic care plan instead of focusing on the pressing nursing problem. Secondly, failure to prioritize nursing interventions. Thirdly, poor structured or incomplete documentation. Having discussed on planning, next to it is implementation. Implementation station is just you administering medication. Implementation station, what you need to do here is to administer medication to this same patient. So in this implementation station, what you are expected to do is simple. It is just to administer medication to this patient. All right, here are those things you need to put into consideration. First, you need to follow infection control guidelines. That is, your hand hygiene is key, as well as maintaining aseptic technique. Your hand must not directly contact the medication. It must be transferred from the bottle to the cover of the bottle, then to the pot. The second thing you need to do is you need to explain the procedure to the patient at all times, carrying them along in what you are doing and obtain consent. You must get a go-ahead before you continue. Thirdly, you need to check the 6 rights of medication administration principle. That is, the right patient, the right medication, the right time, the right route, the right time and date, the validity of the prescription, and the proper documentation after administration. Failure to check the expiration of medication before administering it could be so critical. The fourth thing you need to do is you need to demonstrate professionalism, stay calm, confident, and systematic. Common mistakes to avoid include the first one, not carrying out your hand hygiene. Secondly, skipping ID checks before administration of the medications. The last on APIE stations is evaluation. What you will do here is simple, and it is just 8-minute station. It is just to hand over this patient either for continuous care and management or the patient to be discharged later. In this evaluation station, you don't need to jot anything. Like I mentioned in my previous video, you don't need to jot anything, just go straight. It's just a summary of what has happened in assessment, planning, and implementation. Just a summary of all of those things, and you will have your document handy. The common mistake here is not so many. The most important thing you must not forget is you must link and mention the 2 problems that were identified for this patient, and you need to state and spell out your interventions. Yeah, that's it. The APIE stations test how well you are applying your nursing knowledge in a structured way. If you stay calm, confident, and you practice effectively with right material, and if you are not having enough confidence in yourself, you may sign up for tutorial. Yes, I can guide you. You can check my description for my details if you need any further assistance. Yes. So, you need to hand over this patient using a structured approach, which is SBAR, situation, background, assessment, and your recommendation. Now that you have mastered the APIE stations, I will see you in my next video on how you can improve your OSCE communication skills. And until then, keep practicing OSCE. Bye.